Good morning. Today's topic is extraction in orthodontics. Space is required to move the tooth into ideal location. Correction of crowding, retraction, intrusion, leveling of curve of speed, derotation of anterior teeth, correction of molar relation. Space can be gained by, there are two methods, that is non-extraction method and extraction method. In non-extraction method comes the expansion, interproximal reduction, molar distalization. When to employ the method of non-extraction for gaining space? When the space, that is 6 mm or less of crowding or mild to moderate space requirement is there, severely mesially and lingually tipped posterior teeth or constricted arches, where no skeletal component of malocclusion is present, no need to alter the facial profile when there is cooperation of the patient, growing patient afford more space. Now the question is when to employ the method of extraction for gaining space. It depends upon the nature of malocclusion, facial form and aesthetics, growth pattern, condition of teeth, caries, multifill teeth, impacted ectopic, severe rotation, and health of supporting tissues. Orthodontic treatment may include the extraction of any tooth in the arch, but certain teeth should be retained where possible. Premolar are the most commonly extracted teeth as the part of the orthodontic treatment. Coming to correction of the sagittal interarch relationship. In a class 1 malocclusion, it is preferable to extract the in both the arches because it is not advisable to discourage the development of only one arch more than the other. In most class 2 cases with abnormal upper proclination, it is advisable to extract teeth only in the upper arch and to retract the maxillary incisors and canines. In case of the lower arch crowding, it is advisable to extract in both the arches. Class 3 cases are usually treated by extracting teeth only in the lower arch to discourage the forward growth of mandible. Different extraction procedures in orthodontics. There is therapeutic extraction, Wilkinson extraction, balancing extraction, compensating extraction, serial extraction, phased extraction, and enforced extraction. Therapeutic extractions. Therapeutic extraction is undertaken as a part of full-fledged comprehensive orthodontic treatment, mainly to gain space. Prior to therapeutic extraction, a thorough diagnostic procedure and model analysis is essential for calculation of space requirements. Extraction of the teeth as a part of orthodontic treatment may be required in a number of circumstances. Arch length, arch tooth length discrepancy, correction of sagittal interarch relationship. Sagittal mal relationships such as class 2 or class 3 malocclusion may require extraction of teeth in one of the either of the arch to achieve the normal sagittal interarch relation. The extraction of teeth in such cases helps in establishing normal incisor and molar relations. Angus class 1, these patients are characterized by a normal anterior-posterior relationship. In class 1 bimaxillary cases, both the arches are forwardly placed. In Angus class 1 bimax cases, it is preferable to extract the teeth in both the arches. Angus class 2, in most class 2 cases, the upper dental arch is forwardly placed or the lower arch is backwardly placed. In such cases where there is normal alignment of the lower arch, it is advisable to extract teeth only in the upper arch and to retract the maxillary incisors and canines. However, some class 2 cases are characterized by severe lower arch crowding or excessive curve of speed due to over-eruption of lower anteriors resulting in deep bite. Angus class 3. In most Angus class 3 cases, the lower dental arch is forwardly placed or the upper arch is backwardly placed. Angus class 3 cases are treated preferably by extraction of the teeth only in the lower arch or by extraction in the both the arches. It depends upon the nature of malocclusion, facial form and aesthetics, growth pattern, condition of teeth, and health of supporting tissues. Orthodontic treatment may include the extraction of any tooth extra in the arch, but certain teeth should be retained where possible. Premolars are the most commonly extracted teeth as part of orthodontic treatment. This is called as typical extraction. However, other teeth are also extracted in certain conditions. These are called as atypical extractions. Extraction of upper incisors. The extraction of maxillary incisors is rarely indicated as a part of orthodontic therapy. The extraction of a permanent incisor or canine tooth for orthodontic revision is usually to be avoided unless there is severe displacement of the root apex. Some of the indication of maxillary incisor extraction are severe clotting in the incisor area with unfavorable buccal or lingual displacement of one of the lateral incisors. Any abnormally impacted or abnormally erupted incisors that cannot be brought into normal occlusion with available needs of extraction. Congenital absence of lateral incisor on one side is accompanied by development of a diminutive lateral on the opposite side. To maintain arch symmetry, the lateral incisor on the opposite side needs to be extracted by allowing canines to erupt into position adjacent to the central incisors. Traumatic injuries where the incisors cannot be conserved. Extraction of mandibular incisors. When one of the incisors is completely out of the arch with good alignment of the other incisors and there are tight proximal contacts between the rest of the incisor. All cases which require upper first premolar extraction while canines are in classroom relationship. Bimaxillary crowding cases with no tooth size discrepancy in the incisors. Extraction of canines, ectopically erupted canines, maxillary canine develop far away from their final location and have a long path of eruption from their development site to their final position in the oral cavity. So it is not uncommon for canines for ectopic eruption and impaction. They are difficult to align. Such unfavorably impacted canine or canines that have erupted in unusual location may have to be removed. When maxillary canine is completely excluded from the arch and approximal contact between the lateral incisor and first premolar is good, extraction of the canine may be considered. Deciduous canines may be extracted as a part of serial extraction procedure. Extraction of first premolars. The first premolars are the most commonly extracted teeth as a part of orthodontic treatment. The reason of their extraction is as follows. It is positioned almost near the center of each quadrant of the arch. Their location in the arch is such that the space gained by their extraction can be utilized for correction both in the anterior as well as posterior segment. The perfect contact between the canine and second premolar can be obtained. The extraction of the first premolar leaves behind one premolar and molars which form the posterior segment that offers adequate anchorage for the retraction of the sixth anterior teeth. First premolar extraction is the least apt to upset the molar occlusion as the best alternative to maintain vertical dimension. Indication of first premolar extraction. They are teeth of choice for extraction to relieve moderate to severe anterior crowding in both the arches. The first premolar extracted for correction of moderate to severe anterior proclination as in class 2 dip 1 malocclusion or class 1 bimaxillary protrusion. High anchorage cases premolar is indicated and as part of serial extraction. Extraction of second premolar. The second premolars are usually extracted when the anchorage loss of around 5 mm is desired. Second premolar extraction is preferred when one wishes not to disturb the change in the anterior smile line to maintain the soft tissue. When second premolar is completely excluded from the arch, it is also extracted. In cases of open bite, second premolar, which are relatively located posteriorly, are the source of extraction. This aids in closing the open bite by deepening the bite. Indication of first molar extraction, class 2 cases with mild anterior crowding and minimum overjet. Upper first premolar permanent molars can be extracted. The relief of crowding and reduction of overjet is better treated by distal movement of the premolars and the canine. Grossly decayed first molar extraction should be undertaken before the eruption of the second premolars and second molars so that they may be influenced to erupt into correct position. Skeletal open bite cases in mixed dentition cases can benefit from extraction of first molar as there is tendency for the bite to deepen after extraction of first molars. Wilkinson extraction. Wilkinson advocated extraction of all permanent molars between the age of 8.5 to 9.5 years on account of their susceptibility to caries. The benefits of extracting the first molars at an early age are they are more prone to caries. Extraction of first molar provides additional space for eruption of third molars, and impaction of third molars can be avoided. Overcrowding of the arch is minimized and favors lower risk of caries of the remaining teeth. Wilkinson's extraction has number of drawbacks and contraindication. The second premolars and the second permanent molars frequently rotate as they erupt in the extraction site left by the extraction of the first permanent molar. Adequate anchorage for tooth movement by orthodontic appliances is lost with the removal of first permanent molars. Improper contact between the second premolar and the molar may invite food accumulation. Extraction of second permanent molar. The extraction of second permanent molar, which is uncommon, is indicated for the following reason: to relieve impaction of second premolar, to prevent third molar impaction, lower incisor crowding, distillation of first molars, and open bite cases. Balancing extraction. Balancing extraction refers to the intentional extraction of another tooth of the namesake or any other tooth on the opposite side of the same arch following the extraction in the opposite quadrant. If a tooth is removed only from one side of the dental arch with tight tooth contents, it may result in drifting of the rest of the teeth towards the extraction space. Compensating extraction. Compensating extraction refers to extraction of teeth in the opposite jaws. It is carried out to maintain buccal occlusion. In class 1 bimax or crowding cases, it is usually advised for compensating extraction. And post extraction, they are the extraction carried out due to compulsion caused by grossly decayed tooth, poor periodontal condition, and fractured tooth, impacted tooth, and tooth in line of fracture. Phased extraction, they are the extraction of different teeth carried out in a phased manner at different times in different quadrants. This is mainly done to effect a change in molar relationship. Serial extraction can be defined as the correctly timed planned extraction of certain deciduous and permanent teeth in mixed dentition cases. The dento-alveolar disproportion, our tooth size, arch length discrepancy. Elevate crowding of the incisor teeth, allow unerupted teeth to guide themselves into improved position, lessen the period of active mechanical appliance therapy. Thank you.